Hi, this is Dr. Jen Landa. I'm an OBGYN and integrative medicine practitioner, Chief Medical Officer of Body Logic MD, and a speaker for the Fellowship in Metabolic and Nutritional Medicine. And today I want to talk to you about the specialty workshop I'm going to be teaching in as a pre-conference before the Hollywood, Florida A4M conference. This specialty workshop is on laboratory testing. It's called Laboratory Testing Simplified, Where to Start, What Next. This is going to happen on Thursday, May 19th. I am super excited about this pre-conference day. This is a brand new workshop, which we have identified the need for, I would say, many years actually, and I'm not sure exactly why it hasn't happened before, but I am super excited that it is going to happen now, and I'm excited to be participating because I would say this is one of the questions that I get so often when I'm finished speaking. I come off the stage and answer questions for attendees, and they're always asking me about testing. They're confused, especially about hormone testing, I would say, because I do the bulk of my speaking about hormones. So I get all kinds of questions all the time about what's best. Should I test in serum? Should I test in saliva? Should I test in urine? What about urinary hormone metabolites? All of those things. So if you go to this conference, you're going to have an amazing array of speakers who have just such a wealth of knowledge in this area. Dr. David Zava, he's a PhD. He's run multiple laboratories over the course of his career, and currently runs the RT laboratory, which is an excellent laboratory which measures hormones in all these different modalities that we spoke about, and he is just uber knowledgeable on all of these laboratory subjects. Mark Newman is an amazing resource. I talk to him frequently about different laboratory values and things like that. Todd Lapine, could not say enough about what an amazing doctor Dr. Todd Lapine is. He is he's going to talk to you about GI testing, which I find so crucial in my practice. I can't tell you the number of patients who have come to me after having been through the traditional medicine mill, sometimes for years at a time, with stomach pain, with diarrhea, constipation, et cetera, and we are able to find what's wrong, pinpoint what's wrong, and help them with these chronic issues that they've had, and it's just fantastic. And so GI testing is a really big part of that. And Dr. Deb Matthew is also an amazing fellowship-trained physician who has an incredible knowledge base to help you understand. And she's going to kick it off with talking about simplifying the complex patient. Where do you start? And isn't that really at the crux of it what we all need, especially when you're starting out in the functional and integrative medicine world, but even as a continuing practitioner, I look forward to hearing all of these speakers because there's always something new to be learned, some new nuance in testing, because really, I would say the testing is one of the big things that sets us apart from the traditional medicine world and really enhances your ability to practice in the metabolic and nutritional medicine arena, and to have success in that arena, to find out really what's at the heart of what's going on with your patients. And the testing is a really big part of that. Other things you're going to learn about from Mark Newman, he's going to talk about the HPA axis testing and treatment. I can't emphasize to you how important that is in my patients. You know, I started out, I think like a lot of people, thinking that it's all about hormones, and I'm going to balance people's hormones and they're going to feel amazing. Well, I will tell you, if you don't pay attention to the HPA axis, which is an issue that is at play in, I would say, more than 95% of the patients I see, if you don't pay attention to test that HPA axis and to treat it properly, you are not going to have anywhere near the amount of success with your hormone therapies that you think you should. And if you're currently treating patients and not having the level of success that you think you should, then I think you absolutely need to attend this conference and find out more about the HPA axis, and also about, I'm going to teach about detoxification of hormones. how our body detoxifies and eliminates hormones, and what you want to see, and what is best in terms of that detoxification, and how you can affect the detoxification of hormones. Because when we don't detoxify hormones properly, we don't excrete them properly, and when we don't excrete them properly, they can build up, or we can have dangerous metabolites being made that can increase the risk for disease, especially breast cancer in women. So that's something you really want to learn more about as well. I think it's going to be an incredible day. I am so looking forward to teaching in this module, learning in this module, and I hope you will join us in Hollywood on Thursday, May 19th for Laboratory Testing Simplified, Where to Start, What Next. Look forward to seeing you there.